medical assistant role, also known as MA, and if this is the right role for you. To begin with, what is a medical assistant? So these are healthcare professionals that are trained to support physicians in clinical and administrative tasks. They're integral team members in outpatient care settings such as clinics and medical offices. Some of the general skills that come along with the job include strong organizational and multitasking abilities, effective communication with patients and healthcare teams, knowledge of medical procedures and terminology, and lastly, of course, empathy and professionalism in patient care. So let's dive into some of the general roles and tasks that come along with the job. Again, none of these specific tasks might all apply to your job. Maybe just one of them do, or some of them might not even be mentioned, but it's highly variable based on the clinic or provider that you're working for, what your task actually entails. But these are just some key tasks that are common in the role, and you might also have this in your own position. So first is patient interaction, where you will greet and prepare patients for examinations and procedures. You'll take patient vital signs, including blood pressure, pulse, and temperature. Next is clinical support, where you'll administer medications and injections as directed by the provider. This doesn't apply to every single MA position. It's dependent on what specific specialty your hospital is focused on, or the clinic, or the provider. So you'll be trained on this on the job too, and you'll have everything you need to know before being tasked with this. There's also administrative duties such as scheduling appointments and updating patient records. And lastly, inventory management, where you'll be managing medical supplies and ensuring that all the rooms are properly stocked. Some general experience information is that the hourly wage ranges from $15 to $23, can be more, can be less, highly dependent on the location, the state, and your history of experience in healthcare. The schedule includes regular shifts with occasional evenings or weekends, depending on the healthcare facility, but you'll rarely see 12-hour or overnight shifts. Becoming an MA, and how do you start? So first, check that you're eligible. You must be 18 years old and have a high school diploma or GED. And next, you'll be enrolling in either an MA course, or sometimes you don't need the certification. Depending on the state, for example, in Michigan, some hospitals actually hire without a MA certification. As long as you have demonstrated healthcare experience and background, you'll easily be hired. So this might not apply for every single role that you apply for. But if you do enroll in a program, they can typically last from either 6 or 12 months. 12-month courses obviously are ones that are much deeper. These are higher level, and when you do get hired, the starting pay will be much greater than an entry-level uncertified MA. The costs can range from 1.2 to 10K. 10K is incredibly high, and this is for specialized cases and licenses that you might be trying to get on top of your MA. But I'd say for the most part, they will be 1.2K or below. Taking a certification exam is optional, but they can increase job prospects as they increase your capabilities, your experience, and you will be much more advanced than a typical unlicensed MA. If you do get certified, the exam fees range from $125 to $250. And lastly is employment, where you will be applying to clinics, hospitals, or outpatient facilities. In a rare circumstance, there are also patients that directly hire MAs themselves, and you can find this in your own neighborhood, or go on local job listings where you'll find individuals that are looking to hire an MA for themselves that would go directly to their own home instead of a hospital or clinic. And you'll be expected to obviously have healthcare experience, but you won't always have to be licensed, and the starting pay tends to be higher than the one that you might get paid in a specific healthcare facility. So you can always keep an eye out for those. Some challenges and rewards that are inherent to every job, but let's focus on the MA role. Some challenges: it can be difficult managing a fast-paced work environment because you could be managing both administrative and clinical responsibilities. Some emotional challenges is working in patient care with professionalism and empathy does take a lot of work sometimes, as things don't always go as you want. And lastly, high attention to detail. This is critical for accurate documentation and care, since data tracking and documentation is very crucial to this role. It can be tiring paying such high attention to detail. However, along with challenges, there are also many rewards, some being you can gain firsthand experience in a healthcare setting working directly with both patients and physicians and nurses. You'll be building strong patient interactions and communication skills. And lastly, you'll contribute to improving patient care and healthcare workflows. If you need any more help or need any additional resources, we have summary sheets that give an overview of each clinical role. We have a detailed document with specific training programs and hospitals in each state of your interest. For example, we have California, Florida, Michigan. And lastly, email, DM, or reach out with any additional questions. Good luck!